Interesting. You might gather, German guy. He wasn't interested in coronary problems, but he was interested in giving drugs to patients who had lung infection, but he wanted to give it right into the lung, and they had the sort of drug he's talking about to do directly into the circulation. So he went to his hospital and said, I want to put this plastic tube I've made into the patient's heart and across and out into their lungs. But of course they said, you're completely mad. You can't possibly do this. We all know that if you put something like that into a heart, it will go into an arrhythmia and you will die. That's him. So he went down to his lab and he put this tube in himself and he pushed it up into his heart and across into his pulmonary artery. And then, this is a true story, folks, he had to forego the help of his colleague and refuse to help him, and misled the nurse. That's a crime. And with a catheter already in place, he climbed the stairs to the X-ray room and took an X-ray of himself with a catheter in himself. Okay. So then he goes to the hospital board and says, see, you can do it, and I'm a survivor. So what did the hospital do? They fired him. He was fired. But the story gets good because he then went on to develop this and actually got the Nobel Prize for medicine because his technique fundamentally changed how we could address the heart. And this is some of the original way, then developed hugely in the United States after particularly a chap called Savonarola, who was in Argentine, who developed coronary bypass grafting. Not many people know that an Argentine surgeon invented that. And basically, this is showing it through the arm. We now wouldn't use the brachial. We'd either use the radial or use the femoral, putting tubes up near the heart so we can take pictures of the coronary arteries. And that's me in a very early cancer lab in the Middlesex, showing how he is with a still smiling patient under local. It actually doesn't hurt. Local may be uncomfortable. The tubes can be pushed. I had dark hair, that's up in the Middlesex, we know that it was quite a long time ago. The tubes can be passed up and the pictures can be taken. And the tubes sort of help us to get into the right place, and you can get a picture of each of these arteries and make a definitive diagnosis. And of course now in 2010, this is somewhat old hat, I can't remember what comes next now. We now can get most of this information without even these tubes, using a state-of-the-art 2 years ago 64-slide CT scanner at UCLH, which allows us to do this with a CT scan without the invasion. Why I say 2 years ago? Because the newest 640-slide CT scanner is now open down in the West End. The ability to do this without these good tubes has evolved hugely, which is good because if you want to avoid, can avoid brilliant people, you do. But this technology then led to another Swiss radiologist inventing a technique. We knew from people with blocked arteries to their legs, a chap called Dotter developed a tube that you could squash away atheroma in the leg, that's the build-up of deposits. And a man called Andreas Grunzig said, oh, let's do this for the coronary arteries. And he invented, literally on his kitchen table, a catheter that had a folded balloon on it that you could inflate and get rid of this cholesterol deposit. At least you squash it away, gives time for the heart and the body to mend it thereafter, because you so increase flow that things can then repair nicely. And Andreas Grunzig developed that, and he was headhunted by the USA. He's actually a charming man. I did meet once, and did incredibly well, developed this technique which is now completely overtaken, and the majority of blocked arteries are dealt with this sort of technology. He unfortunately, having his newfound wealth, took up a hobby of flying aircraft and then flew himself into a mountain. Usual story. So, having just had balloons, then what was clear was that if you opened the arteries, they tended to close down again. And so a thing called a stent was invented, where you have a lovely folded, beautiful piece of metal work that when the balloon inflates, the metal lattice is increased. And then that stays behind in the artery as a framework upon which the repair process the body does builds, and these are the so-called stents. Because they're metal, they attract clot, so they require blood thinning treatment in the form of aspirin and vinegar to prevent clots forming. But because it's metal, it's also alien, and there tends to be a vigorous response in terms of healing that blocks them up when we first use them until we embedded them with drugs, allied to the drugs that you use in cancer, that prevent cell division. And now stents really, the blockages in stents are running at probably less than 2 to 3% per annum, so 97-98% remain open forever. There still is a need for cardiac surgery. I won't go into this very greatly, where the surgeon either moves the internal mammary artery from your left subclavian up here, or uses a vein from the leg to bypass block surgery. So there's still people that require this kind of surgery. It's still an immensely useful